Hi, and welcome to the seventh presentation in a 10-part series, Medication Class, The Pivot Perspective. Here is a necessary legal disclaimer. Dietary supplements are not evaluated by the FDA and are not intended to diagnose, treat, cure, or prevent any disease. Always consult with your own healthcare provider before changing any of your medications or starting a dietary supplement. This presentation and the other information on my website are for information and educational purposes and should be independently verified and assessed before making any personal healthcare decisions. Hello, my name is Dr. Amy Naparick. I am the founder and CEO of Pivot Integrative Consulting. I'm a doctor of pharmacy with over 20 years of experience in community pharmacy practice. As an integrative pharmacy specialist, I empower my clients to discover root causes for chronic conditions and improve gut health using functional and lifestyle medicine, integrative pharmacy, and nutrition recommendations. I believe in food as medicine to heal the gut and provide better overall health and wellness. Today, we are going to talk about antibiotics and micronutrient depletions, as well as the importance of our gut health. For today's objectives, we'll answer the following questions. What are antibiotics and how do they work? What are some side effects from antibiotics? What micronutrients are depleted by antibiotics? Why is gut health so important? And how can Pivot help you reach your health and wellness goals? Let's talk a little bit about antibiotics. In 2021, 211 million prescriptions were dispensed in the United States for antibiotics, and the area with the highest outpatient antibiotic prescription rate was in the southern United States, where I live. Let's explore why this might lead to certain complications. Antibiotics are compounds that target bacteria. So, antibiotics cannot work against viruses, fungi, or protozoa, which are other organisms that can also cause infection in humans. Antibiotics can be broken into two groups, bacteriostatic and bactericidal. In very simple terms, bacteriostatic antibiotics prevent the growth of bacterial colonies and allow the body's natural immune system to destroy them. Bactericidal antibiotics kill the bacterial colonies. When you get an infection, your doctor needs to determine what kind of microorganism is causing the infection and then choose the right kind of antibiotic to fight against it. So antibiotics can also be grouped as broad spectrum or narrow spectrum antibiotics. Broad spectrum fight against a variety of bacterial species, while narrow spectrum are more specific. People often ask me, is this a strong antibiotic? But strength of an antibiotic is relative to the bacterial species it is trying to fight. This can often be determined by performing susceptibility testing. Unless the prescriber cultures a sample from the patient and performs tests on which antibiotic can best fight the offending agent, the prescriber is just taking an educated guess as to what the bacteria is causing the infection, and then uses standardized guidelines to give the normal course of treatment for a certain illness. However, most upper respiratory infections, sore throats, and stomach flus are caused by viruses. It is possible to get a secondary bacterial infection after being sick with a virus, but most people visit their doctor for the initial viral symptoms. Unfortunately, many patients demand a prescription from their providers so they can feel like they're doing something to fight their illness. And also, unfortunately, many providers give in even though they suspect the offending agent might be a virus. It's just easier to write a prescription than try to argue with the patient about how it's not necessary. Antibiotics will not work against a virus, so please don't be one of those patients. Viruses are best fought with rest and fluids and providing immune support like bone broth, vitamin C, zinc, and elderberry. Please ask your healthcare provider whether they think your infection is caused by a virus or a bacteria, and do not accept a prescription for antibiotics if the answer is viral. Let's look at the classes of antibiotics that might be prescribed. Here are some of the bacteriostatic antibiotics. Remember, bacteriostatic antibiotics typically slow the growth of bacterial colonies so the body's natural immune system can fight the infection. You might recognize some of these names as antibiotics you've been prescribed before, and others might be foreign to you. Some antibiotics only come as injectable or intravenous medications and are often only used in the hospital, like tigecycline. On this list, we also have tetracycline, doxycycline, minocycline, and clindamycin. The rest of the bacteriostatic antibiotics include azithromycin, otherwise known as the Z-Pak, clarithromycin, erythromycin, linezolid, and sulfamethoxazole, which is often paired with trimethoprim under the brand name Bactrim. Azithromycin is one of the most prescribed antibiotics for upper respiratory infections. Unfortunately, many upper respiratory infections are viral, so azithromycin has quickly gone from a blockbuster treatment to a highly resisted antibiotic. Now we have the bactericidal antibiotics. Remember, in simple terms, these kill the bacteria. We have the fluoroquinolones, ciprofloxacin, levofloxacin, and moxifloxacin. There is also vancomycin and daptomycin. Vancomycin is not absorbed when used by mouth, so to get it to the other parts of the body, it must be given by IV. That is, unless the infection is in the intestines, like in the case of a serious infection called Clostridium difficile, or C. diff for short. Then a capsule is usually given. Some more bactericidal antibiotics are found as eye drops like tobramycin or gentamicin. Tobramycin is also available in a breathing treatment for cystic fibrosis, which is a lung disease. Amikacin is an IV form that is used in hospitals. Next, we have a very popular group called the beta-lactams. Penicillin and amoxicillin are common antibiotics prescribed, especially in children. Piperacillin tazobactam and amoxicillin clavulate are also part of the penicillin family. Cephalosporins are kind of like a cousin to the penicillin family, and that includes the antibiotics like cephalexin, ceftonir, or cefazolin. There are many others, but that would have taken up an entire slide. We also have meropenem and imipenem in the beta-lactam group. There's also metronidazole. Metronidazole has an interesting warning with it. You should never have alcohol or alcohol products with metronidazole. I've even heard of reactions with hand sanitizer and mouthwashes that contain alcohol. What is that reaction, you ask? Oh, projectile vomiting. Yep, fun times. Now, speaking of side effects, let's look at some more of those. Side effects for antibiotics depend on the specific one being used to treat your infection. Always ask your healthcare provider or pharmacist about what to expect with any medication you are prescribed. Some side effects may include serious reactions, like a severe allergic reaction that leads to swelling, difficulty swallowing, or difficulty breathing. This is an anaphylactic reaction and requires immediate intervention of emergency services. A rash can also occur, potentially indicating an allergic reaction as well. Rashes can be anything from some mild itchy red spots to something more severe like Stevens-Johnson syndrome, where your skin actually starts to slough off. There is another explanation for a mild rash, however. Mild rashes could be due to endotoxemia. As the bacteria are dying, they are releasing lipopolysaccharides, and those can get into the bloodstream, especially if you have leaky gut, and that is what can cause the skin reaction. Some other common side effects of antibiotics include GI issues, nausea, stomach pain, and diarrhea. Some antibiotics can also cause tinnitus or ringing in the ears, decreased kidney function, or changes to your normal heart rhythm. There's also an increased risk for bleeding, especially if you take blood thinners like warfarin. This is because the good bacteria in your body makes vitamin K, which is essential for making your clotting factors. If you kill the bacteria, less vitamin K is being produced, which makes a bleeding risk increase. That leads us to the micronutrient depletions of antibiotics. Antibiotics can deplete B vitamins like folate, B1, B2, B3, B6, B7, and B12. Vitamin K can also be depleted, and antibiotics can cause gut microbiome dysfunction. These vitamins are made by the good bacteria in our gut. So it makes sense, right? If you're killing off the bad bacteria, we're also killing off the good bacteria, which help to make these vitamins. And so it makes depletions of these vitamins more likely. Other antibiotics like doxycycline, azithromycin, and levofloxacin can also deplete things like potassium, calcium, iron, magnesium, and zinc. So let's talk about each of these depletions from the B vitamins all the way to zinc. The first is folate, and folate is the key to healthy cell growth and function. Also helps with making DNA and RNA and is necessary for the formation of red blood cells. Folate is part of the methylation pathway, which assists the body with detoxification. Folate also reduces the risk for birth defects and preterm birth. Folate is especially affected by the antibiotic Bactrim. Remember sulfamethoxazole and trimethoprim? That antibiotic actually blocks the folic acid pathway in bacteria. So if you've listened to previous programs, you may have heard me talk about genetic changes and how someone's folic acid pathway might already be blocked. So taking Bactrim with this genetic predisposition is not a good idea. A folate deficiency can also show up as anemia with weakness and fatigue, difficulty concentrating, irritability, and headaches. A person with a folate deficiency may also have mouth or tongue sores and changes in skin, hair, or fingernail pigmentation. As mentioned previously, folate is part of the methylation pathway, which is part of the body's detoxification process. A folate deficiency also leads to a higher risk for dementia and neural tube birth defects like spina bifida in women of childbearing age if they do not have enough folate. Some foods that are a good source of folate include our legumes, the beans, peas, and lentils, nuts like almonds and walnuts, asparagus, eggs, leafy greens, citrus fruits, and the brassica family like broccoli and Brussels sprouts. Next is vitamin B1, which is also known as thiamine. Thiamine is important for energy metabolism, so growth, development, and function of cells. It is a cofactor for glucose, amino acid, and lipid metabolism. Without it, our bodies cannot break down the components of our foods. Some bacteria in our gut can make thiamine, so our gut health is so important. Thiamine deficiency can cause weight loss, confusion, short term memory loss, muscle weakness, and an enlarged heart. A severe thiamine deficiency is also called beriberi, which is usually diagnosed when the person presents with severe nerve damage and wasting. Many foods in the US are fortified with thiamine, so we can usually get enough in our diet. Some foods that are naturally good sources of thiamine include pork, black beans, seafood like mussels, trout, and tuna, acorn squash, and sunflower seeds. Next, we have vitamin B2, which is also known as riboflavin. This B vitamin is also important for energy production in our cells and the breakdown of fats, drugs, and steroids in our body. Bacteria in our gut can make riboflavin and actually produce more with a vegetable based diet versus a meat based diet. Riboflavin deficiency is rare in the United States since so many of our foods are fortified with B vitamins. However, low B2 levels can cause skin disorders, mouth or throat swelling, sore throat, cracked lips and sores at the corners of the mouth, hair loss, and reproductive problems. If the B2 deficiency is severe, it can also cause nerve and liver damage. Some good sources of riboflavin include beef liver, dairy products like yogurt, cheese, and milk, clams, almonds, mushrooms, quinoa, and eggs. Next, we have vitamin B3, which is also known as niacin. Like the other B vitamins, niacin is important for energy production in our cells. It also helps with cellular communication, how our genes express themselves, making cholesterol and fatty acids, and can function as an antioxidant. Niacin is sometimes used to help people balance their cholesterol. One side effect of niacin is skin flushing, like a hot flash. A severe niacin deficiency is also known as pellagra. Low niacin levels can cause rough skin that turns red or brown in the sun. GI issues like vomiting, constipation, or diarrhea. Depression, headaches, extreme fatigue, aggressive or paranoid behavior, and a bright red tongue. Foods that are a good source of niacin include beef liver, other meats like chicken, turkey, pork, and beef, salmon, brown rice, seeds like pumpkin or sunflower seeds, and lentils. Now let's look at vitamin B6, otherwise known as pyridoxine. Vitamin B6 is essential for protein metabolism, cardiovascular health, cognitive function, and immune function. People with a vitamin B6 deficiency can have microcytic anemia, which means the red blood cells are undersized. Skin conditions, depression, confusion, and decreased immune function. Some food sources of vitamin B6 include fish, organ meats, potatoes, chickpeas, avocado, sweet potatoes, bananas, and sunflower seeds. Okay, let's look at vitamin B7, otherwise known as biotin. So, biotin, like the other B vitamins, is water soluble and helps to convert the foods you eat into energy for your body's cells. It is especially important for fatty acid metabolism and helping the body make glucose from amino acids, which are the building blocks of protein. That's right, your body doesn't need carbohydrates necessarily to make glucose. It can also make glucose from proteins. The vitamin B7 or biotin can also make leucine, which is an essential amino acid that our body cannot make on its own. Biotin is known for healthy hair, skin, and nails, but it also helps with controlling blood sugar levels, brain function, kidney function, and eye health. Biotin deficiency can lead to thinning hair and hair loss, skin conditions, brittle nails, depression, fatigue, and eventually hallucinations. Some food sources of biotin include beef liver, eggs, salmon, sunflower seeds, sweet potato, and almonds. Next, we have vitamin B12. This is a necessary vitamin for nerve and brain health, red blood cell formation, bone health, and insulin sensitivity. Some signs and symptoms of a vitamin B12 deficiency include megaloblastic anemia, which is abnormally large red blood cells, which this can present as fatigue and pale skin, as well as weight loss. You can also have heart palpitations, dementia, infertility, and numbness in the hands and feet, which mimics peripheral neuropathy and diabetes. Some food sources of vitamin B12 include organ meats, beef, clams, fish like tuna and salmon, eggs, and dairy like milk, yogurt, and cheese. Sometimes a supplement is still necessary to achieve optimal levels of vitamin B12. Okay, now we have potassium. And potassium, along with sodium, is important for maintaining proper fluid balance in the body. It is also important for muscle contractions and regulating digestion, transmitting nerve signals, and maintaining proper pulse rates. Signs of a potassium deficiency include weakness and fatigue, muscle cramps, digestive issues, abnormal heartbeat, tingling, and numbness. Some foods that are good for potassium include dried fruits like apricots, prunes, and raisins, lentils, acorn squash, kidney beans, bananas, and fortified orange juice. Next is iron. Iron is a necessary component of red blood cells. Iron is used to form hemoglobin, the part of the red blood cell that carries oxygen around the body. Iron is also involved in immunity and brain health. Mood and emotional health is also influenced by iron levels. Ferritin levels, which are the stored iron levels, have been shown to be lower in people with depression and mood disorders. Vitamin C helps our bodies absorb specific forms of iron more easily. Iron deficiency appears as weakness and fatigue, anemia, poor endurance, inability to maintain body temperature, so you're always cold, poor concentration, decreased immune function, and impaired development in children. Food sources for iron are divided into two categories, heme and non-heme iron. Heme iron is found in meat sources like lean meat and seafood. Non-heme iron is found in non-meat sources like vegetables, grains, and nuts. So, some good sources of iron include oysters, white beans, lentils, chickpeas, and tofu, liver, spinach, and dark chocolate. Okay, now we have calcium. Calcium is important for bone health, muscle health, blood clotting, nerve function, and thyroid function. Taking calcium with vitamin D helps to increase its absorption. Calcium deficiency can cause osteoporosis and brittle bones, poor dental health, cataracts, muscle cramps, weak and brittle nails, inflamed, itchy, dry skin, and hair loss. Some foods that contain calcium include dairy products, of course, like yogurt, cheese, and milk, but there are non dairy sources as well. Leafy greens, tofu, and soybeans, fish that contain small bones like sardines or salmon, figs, and seeds like chia seeds also contain significant amounts of calcium. Now we have magnesium. Magnesium is important for energy production, converting food to energy. Magnesium helps with the muscle contractions and relaxation. Magnesium regulates neurotransmitters that send messages throughout the brain and the body. It also helps to form our genetic material, DNA and RNA. It regulates calcium to support bone structure. Magnesium deficiency may appear as fatigue, weakness, and loss of appetite, as well as nausea and vomiting. Someone with a magnesium deficiency may also experience muscle spasms or stiffness. Low magnesium levels may lead to an increase in blood pressure, blood glucose levels, brittle bones, and osteoporosis, as well as worsening migraine symptoms. Nuts and seeds like almonds, cashews, flaxseed, and pumpkin seeds are good sources of magnesium. Legumes like black beans, edamame, peanuts, and lima beans also contain magnesium. Quinoa, spinach, and dark chocolate are also foods that contain magnesium. In fact, if you find yourself craving chocolate, you may be low in magnesium. That may be a sign that your body's giving you. And finally, we have zinc. Zinc is essential for immune function, wound healing, growth and development, especially in children, gene expression, and making DNA and proteins. Zinc deficiency can cause an increased risk of infections, slow growth and development, birth complications, diarrhea, changes in taste and smell, and delayed wound healing. Some foods containing zinc are seafood like shrimp, crab, and oysters. In fact, oysters have almost 3 times the recommended amount of zinc. Other foods include meats like beef, turkey, and pork, pumpkin seeds, cheese, lentils, and sardines. Now let's talk about gut health. Okay, so with gut health, we have this intelligent barrier system. When balanced, our microbiota lets in the good and keeps out the bad. But with dysbiosis, which is an unbalanced microbiome, that can lead to a leaky membrane in our intestines or the breakdown of the mucous membrane. And so that lets things into our bloodstream that can lead to systemic inflammation. Another reason why our gut health is so important is that most of our immune cells in our body are actually found in the gut associated lymphoid tissue, or GALT system. Specialized immune regions called Peyer's patches actually allow for communication from the GALT to the rest of the body. So it acts like an alarm system to the body that the immune system needs to be activated. And finally, the microbiome in your gut, like we've mentioned, makes the B vitamins, which are essential for most cellular processes, as well as making energy in the mitochondria. They also make vitamin K, which is essential for blood clotting. And 90% or more of all of the serotonin in our body is in our gut. Serotonin is one of the neurotransmitters responsible for our mood. There are some chronic health conditions that are associated with poor gut health. They include obesity and metabolic disorders, autoimmune disorders like rheumatoid arthritis, multiple sclerosis, and lupus, as well as inflammatory bowel diseases like Crohn's disease and ulcerative colitis. Mood disorders like chronic depression and anxiety, colorectal cancer, skin disorders like psoriasis and eczema, as well as chronic allergies and asthma, are also associated with poor gut health. We can also see endocrine diseases like diabetes and thyroid disorders, migraine headaches, and hormonal imbalances like PCOS, endometriosis, and breast cancer linked to poor gut health. So, whenever you must take an antibiotic for an infection, I recommend also taking a probiotic. You could even take two different ones and alternate, or take one in the morning and the other in the evening. But be sure to separate the antibiotic from the probiotic by at least 2 hours. I also recommend taking a B complex that can help to replenish the lost B vitamins. Make sure that your healthcare provider is checking and optimizing your vitamin D levels. You can also take vitamin C and zinc to boost your immune health, as well as elderberries to support your immune function at the first sign of illness. Of course, check with your healthcare provider before starting any supplement. Here is my list of references for this presentation. So, how can Pivot Integrative Consulting support your health goals? Let me tell you a little bit about what we offer. We offer concierge consulting services. You can take a deep dive into your health with a comprehensive personalized consultation with an integrative pharmacy specialist. Our recommended programs are typically 6 months long and include one-on-one sessions, lab testing and reviews, nutrition and supplement recommendations. Let me help you discover root causes for your chronic conditions. We take the time to listen to you and your needs and develop a plan that works for you and your goals. So, are you ready to pivot to functional health and wellness? Is this your year to discover underlying causes of disease and feel your best? Contact me today for a free connection call. info@dramynafric.com. Feel free to contact me at info@dramynafric.com for that free connection call, or if you have any questions about this or any of my presentations. Also, check out www.dramynafric.com for more presentations and articles about health and wellness. Thank you for being here today.